Hello, everyone. This is Dr. Eric Phelps, an orthodontist from San Jose, and I'm really excited to invite you to the American Academy of Craniofacial Pain event in Santa Clara at the Hyatt Regency. And we have a great team. It's going to be bringing together psychiatry, sleep medicine, ENT, orthodontics, and oral surgery to talk about airway anatomy. We're calling it the Airway Anatomy Forum. And tonight I'd like to introduce you to Dr. Anil Rama, the sleep physician that I have the privilege of working with.
Thank you, Eric. It's a pleasure to be here.
We've been working together for, I guess, a little over 3 years now.
Yes, it's amazing. It's been a mutual collaboration.
And not only do we help treat patients together, but I learned so much from working with you. It's a great collaboration. You've introduced me to the psychiatrists from Hawaii that are coming out. And so maybe just share a little bit about that connection.
I focus on sleep and brain health, and I work with the large psychiatry group, Dr. Jason Keeper in Hawaii. And, together we just teach each other things from airway to brain health to respiratory health to everything.
So the incredible thing for me is that I've been able to see the connection between midface deficiency and therefore midface development, improving midface anatomy, airway function, and then the connection to not only better sleep, but better nasal breathing, and then improved brain function. So what will you be talking about at the forum?
I'll be taking it one step further, a little bit lower. So we realize that it's improving nasal patency, expanding the maxilla, advancing the maxilla, all improves airway and breathing. And like you said, it improves brain health. But what's fascinating is that when you go a little bit lower and you focus on respiratory muscle strength, the expiratory muscle, the abdominal muscles, the inspiratory muscles like the diaphragm, you can actually improve airway, nasal resistance and flow, whatnot, just by improving respiratory muscle strength. The rhinomanometry improves, the apnea improves. And so you can get benefit beyond ENT, orthodontic expansion, maxillomandibular advancement. And that's what's fascinating. You can, you're not done. Or you can, as an adjunct, you can add respiratory muscle training.
Fantastic. So the other thing that we're going to be doing is on Friday night, we're going to have roundtable discussions during dinner. You're going to be hosting a table. What are the things that you'll be discussing at that event with a group of, let's say, 10 doctors that sign up for your table?
Well, I wanted to go over capnography, how low CO2 levels or over breathing can impact the person's symptoms, anxiety, focus, and other things.
Perfect. Well, I really appreciate you committing to the event. Look forward to your presentation, and honored to be able to work with you and call you my friend.
No, it's my pleasure, Eric. You're wonderful. Thank you. And thanks to the Academy. And thanks for putting this together. It's amazing amount of work you've done.
Oh, our pleasure.